This video's aim is to help if you are suffering with a rotator cuff tear in your shoulder. A rotator cuff tear is damage to the tendon or tendons of your rotator cuff. First, you need to understand the anatomy of the shoulder and rotator cuff. The shoulder is made up of the humerus, scapula, clavicle and rib cage. It has more than one joint. You have the glenohumeral joint, the acromioclavicular joint, and the scapular-thoracic joint. The main shoulder joint is very unstable, which allows a lot of movement, so the joint relies on a group of muscles and tendons which are collectively called the rotator cuff. The rotator cuff is made up of supraspinatus, infraspinatus, subscapularis, and teres minor. A rotator cuff tear is damage to the tendon or tendons of these muscles. The most commonly injured is supraspinatus, and this can be due to wearing the tendon away from shoulder impingement syndrome, which there is another video on this particular injury on YouTube. Rotator cuff damage can be minor all the way up to a rupture, which is when the tendon essentially snaps. If the tear is minor, then it can heal without the need for surgery. However, if it is severe or even ruptured, then surgery is the most likely option. It can happen traumatically at any age, but is more common and more likely to occur as you get older and can therefore damage over time. If you play a lot of sports or perform activities regularly which involve overhead movements such as tennis, repetitive throwing and lifting, then your risk can be greater. One of the most common signs of a rotator cuff tear is the inability to lift your arm up actively. However, it can be less pain or pain-free when your arm is lifted up passively without using your own muscles. The drop arm test is often done as follows. If you are unable to keep your arm up and it drops back to your side, then you may have a rotator cuff tear. However, there are other signs too. For example, hitching the shoulder when you try to lift it up out to the side. Symptoms: pain usually at the front or side of your shoulder, and depending on severity, it can radiate down your arm. Sometimes the shoulder will feel warm. Diagnosis: your GP or ideally a physiotherapist are best placed to diagnose the problem, but in some cases a scan is needed to accurately diagnose it. What should you do? Avoid any aggravating movements, for example lifting your arm up actively. You should however passively stretch the joint, as your joint can get stiff, and if you are between 40 and 70 years old, then you risk getting a frozen shoulder if you don't do this. Apply ice over the shoulder. Always wrap the ice in a towel to avoid an ice burn. And apply for 15 minutes every 2 hours. Take a course of anti-inflammatories unless you have been advised not to take these by your GP. Painkillers will help to control pain until it subsides. Take advice from your pharmacist. A physiotherapist can help to put a tailored exercise program together for you that can gradually progress your recovery. However, here are some exercises that might help. Scapular setting against a wall. This exercise can help to improve your posture. Stand with your back against the wall so that your head and bottom are in contact with the wall. Keeping your arms relaxed by your sides, squeeze your shoulder blades together and slightly down without losing any contact with the wall. The wall should help you to feel the correct movement. Hold this squeeze for 10 seconds and repeat 5 times. Repeat this little and often through the day. Passive wall stretches. Try to do these little and often throughout the day. Flexion. Stand facing a wall and using your good arm, lift your arm up and out in front of your body and place your hand on the wall. Now lean your body forward so that you feel the stretch in your shoulder. Hold for 20 seconds and repeat 3 times. Abduction. Stand side onto a wall and using your good arm, lift your arm up and out to the side and place your hand on the wall. Now lean your body sideways so that you feel the stretch in your shoulder. Hold for 20 seconds and repeat 3 times. External rotation. Standing in a doorway with the palm of your hand on the frame while keeping your elbow by your side at all times. Step forward until you feel a stretch. Hold for 20 seconds and repeat 3 times. Hand behind back. Take hold of a towel at one end and dangle it down your back. Now with your arm you want to stretch, grab hold of the other end of the towel. Now using the upper arm, pull the towel up so that it stretches your lower arm. Take it to the point of stretch and hold for 20 seconds and repeat 3 times. If you get worsening symptoms or are unsure, then initially reduce the push into discomfort. If this isn't enough, then stop altogether and consult your physiotherapist. After several days, you should hopefully notice increased flexibility and possibly reduced pain generally. Once you are able, your physio can guide you through pain-free rotator cuff strengthening and proprioceptive exercises to build it back up to full function. Remember, injuries take time to recover and do so gradually, especially the shoulder, so be patient, there are no miracle cures. Research shows that the recovery time from a conservatively managed rotator cuff tear can take 6 months or more, but this will obviously depend on the severity of the tear.